So typically, interestingly enough, I am a Medicaid provider, and some other insurances do see me at providers, others don't. So oftentimes I will have to say in my situation, in a modest percentage, I'd say 95% of my patients are referral based. I provide x-rays, obviously, because I can take x-rays. I provide everything essential for a dentist to know.
So you could probably be like the best friend to practices then, because it's like, hey, you're going out and finding the patients that probably wouldn't find these practices. So you could almost act like as a marketing arm for some of these practices that you're partnering with, which I'm sure they love. Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the founder of SMC National, where we help level the playing field for offices just like yours against the big DSOs out there that are trying to crush you and not let you get the new patients that you deserve and need to grow. Today, I have Sarah Tanner, who's the CEO and founder of the Luxury Tooth Booth, and she's going to be sharing how she's building her business. This is really, really exciting. Now, this may not apply directly to you, but I think this is going to be a new thing in the future that multiple states are going to be doing. Other people are doing it as well, but other people might be opening it up. So you're going to want to learn how she runs her business, how she partners with dentists, and how she helps serve a community that no one's serving right now. You're going to want to pay attention to this one. Stay tuned. Live, and Sarah, I'm excited to have a conversation with you. It looks like you're actually inside your tooth booth. Is that right?
Yes, I am. I'm actually sitting in the patient chair because it's pretty comfy.
I just noticed that, like right as I hit record, I was like, it looks like she's in a spaceship. So Sarah, why don't you tell us what you're seeing right now that's really impacting growth? And I'm really interested about your perspective about this, because you are approaching the problem of patient care from a unique angle.
Yes. So I have to preface by saying that I do live in the state of Colorado, and the scope of practice within Colorado for dental hygienists is amazing. I think there's only a few states out there that allow us to practice independently. So I kind of took initiative since graduating hygiene school and stating, hey, I have the opportunity to do this differently. So as the years progressed and I worked in peri offices, general offices, elderly-based offices, family-based offices, I was just kind of thinking, how do I target my people, which is the Hispanic community? They're not at the dentist. They don't go to the dentist. So how can I, as a dental hygienist, meet those people or meet people who aren't in the traditional dental office? So I always swore I was never going to be an entrepreneur, but here I am in my own place. And so I was just kind of being innovative and thinking about, how do I meet people where they are? Not only physically. So I put my practice on wheels. I'm in a shuttle bus, which my husband constructed, and I bought a dental unit. He's put the solar system in, the plumbing in. So I'm like a miniature version of a dental office on wheels, and I provide preventative dentistry directly to patients in front of their home, their apartments, their workplaces, their facilities. So I meet them where they are.
Wow. Okay. That's awesome. So what are you allowed to do? Like as a hygienist, what are you allowed to start working with people on, as far as like, is it just cleanings? Are you allowed to do other stuff? Like, how does that work?
Yeah. So of course I do like an evaluation, like I always do an oral cancer screening, a Mallampati score, kind of airway driven kind of things, just because I'm interested in that and love to identify that. So we can do an evaluation, look for things. Can't say at all that it's a decay, but we obviously know with years of experience, wow, that's sticky, that's brown, that looks suspicious, that needs dentist attention. And then we take x-rays here in the office. I'm allowed to take x-rays independently just because I need to see bone loss. I need to be able to diagnose periodontal disease. And that's within the scope of our practice, is being able to diagnose that aspect of care and treating it. So that's basic cleanings, periodontal maintenances, SRPs, things like that, and providing medicaments to help patients just get healthier in the hygiene realm. And then I can do teeth whitening, kind of the cosmetic aspect of care, but predominantly hygiene care.
Okay. And then, so walk me through that. So someone reaches, if I'm a patient, I'm reaching out to you, or are you coming and finding me with your van? Like, how does that work?
So typically, interestingly enough, I am a Medicaid provider, a Medicare, Medicaid, Delta Dental Colorado, Cigna, and some other insurances do see me at providers, others don't. So oftentimes I will have to say in my situation, in a modest percentage, I'd say 95% of my patients are referral based. So it's people that that have the services in here and have stated, wow, this is a great service. I'm going to tell my friend about it. I've only had a handful of Medicaid patients look me up through the Medicaid portal and say, oh, wow, it looks like you can come to me. And I don't limit or restrict who I can see. So it's a far range from CHP plus children, infants, up to elderly homebound patients. So typically, sometimes they find me. Sometimes it's a, hey, so-and-so referred me. Can I set an appointment?
Got it. Okay. So then you travel all the way over there, you clean their teeth.
Yeah.
And then if the patient needs work, so if it's like, oh, you need a crown right here, you need a filling right here, you got a lot of problems, then what happens there?
Yeah. So I have an intraoral camera to take an image of the area. I provide x-rays, obviously, because I can take x-rays. I provide everything essential for a dentist to know and say, and provide. And that's the tricky part, is the collaboration between the patients, either if they have a dentist or if they don't. I've temped around the Denver metro area enough to have several dentists that I worked for and then refer to them. But most of my patients have their own dentist. So it's emailing everything safely and securely to the patient within the email and the dentist about their visit with me and my concerns that I had. And then just to follow through with exams with the dentist.
Got it. Okay. Awesome. And then, so you're referring them out, and then are because you're dealing with a lot more Medicaid, are patients, likely to follow your advice, or are they like, no, because I'm on Medicaid, is it going to be covered by the Medicaid? Do you have to work with the right partners? Like, how does that work? How does that, because there's some nuance there.
Yeah. So interestingly enough, I don't know the percentage of my Medicaid patients, but it's incredibly low. In fact, I was surprised. I was like, great, I'm going to be a practice that's going to really tackle that Medicaid population. I have maybe 4% within my practice. Predominantly, it's your regular insurance or uninsured patients that I see. So yes, most of my patients already value oral health already, but those that don't, that are really, and it's mainly fear that's keeping them away from the dentist. So I am that initial step of saying, hey, let's get your gums under control. Let's make them less tender. Let's get you ready to go see the dentist. And then by the time you see him, he or she will have to target that particular concern.
Got it. Okay. So what percentage would you say your Medicaid is that you're serving?
I'd say about 5, which is interesting.
5%. Okay. So you're mainly serving. Okay. I totally misunderstood. So you're mainly servicing people. And then what's the age group that you're usually servicing?
That's a variety as well. So I see your 3-year-olds with mom in the practice. I see family units at a time. And then as of late, I've had more in-home bed-bound patients. So
like elderly.
Yeah. And those individuals that can't move out of their bed or their, kind of recliner or anything like that. So I come conveniently into their homes to provide care.
Got it. And then so you could probably be like the best friend to practices then, because it's like, hey, you're going out and finding the patients that probably wouldn't find these practices. So you could almost act like as a marketing arm for some of these practices that you're partnering with, which I'm sure they love, because obviously, and you don't get in Colorado, you can't do kickbacks or anything like that, right? So you're just,
I don't believe so. Yeah. Okay. I guess I would assume it would work like a specialty office where I refer to the dentist because they need it. Yes. And then they can refer to me as like a specialist. And that's where some dentists.
So dentists are actually referring to you. So I'm like, if someone's like, my mom is at home, I can't, it's so stressful. And really the doctor probably doesn't even want to deal with it, right? Because that's just a crazy headache. Then what ends up happening then is you are then they're referring to you, but they're happy to do that because it's saving them a bunch of time. That makes a ton of sense.
Yeah. And then I can really free up their hygiene department. So it's a struggle getting a hygienist right now for bookings, maybe 9 to 6 months out. I am available as early as next week. So that's where I'm not as busy, but yet I'm able to kind of target a family at a time versus taking up 4 or 5 hours of an office's time. That 4 or 5 hours can be condensed down to an exam with a dentist, and then they can be seen within 15, 20 minutes. Or if treatment needs to be made, that just streamlines the treatment process because I've already provided all the information. Yeah.
Got it. And then how does and I understand if you don't want to share like every single nook and cranny, but I want to know, like, how does the economics of this work? Like, does it make sense for you to own this? Like, would it be better if you were just like a high performing hygienist at an office? Like, and again, if you want to be specific, be specific, or if you want to be general with it, I'm totally good with that.
Yeah, I'm okay. As some people have said, sharing the secret sauce. I am an open book. Like, I don't care. Just because I think there's 2.5 million people in the Denver metro area. There's
not enough of you, right? There's plenty.
Yeah.
We could open up 10 Sarah luxury tooth booths and you'd still be fine and plenty to do, right?
Yes, absolutely. So yes, it's economically, and it's beautiful because I don't have to be hourly. I do wear a lot of hats. I am the insurance coordinator, treatment planner. I am the cleaning person. I am the assistant. I am the dental hygienist. So, and I do the front desk, marketing, all that good stuff as of right now. So the goal is to expand those duties later on, but I do all of that now. So economically, yes, it's incredibly profitable because I'm just not getting that hourly rate. I'm also getting maybe the medicaments that I offer, or prescription toothpaste, or education. And that's where it gets kind of tricky. So there's a standard of care that I love to provide per evidence-based research that's out there that I've done through public health CE courses or biological and holistic education. So povidone iodine is one, like providing that in irrigation during Capitron use. And then saliva testing, like all of that has taught me to provide the best care to patients. Insurance doesn't pay for irrigation, but yeah, it's a standard of care that I want to keep. And then some insurances don't provide the convenient home, I guess, delivery of care. And then some do. Medicaid does, for instance. So yeah, it's a juggle between really taking care of patients, but then being profitable at the same time. So yes, it's definitely better than working at a fast-paced double column dental hygiene practice for sure.
Yeah. Yep. Okay. So you like it better from that standpoint. Is it more profitable than that for you? Like, do you make more money if you were?
Yes. Yes, because there's little things that I can charge out for, like a limited exam.
That's what you were trying to explain to me, is that you're getting, so that $30 you're charging for that thing, that's just cream on the top for you.
Right. And then I can charge out for x-rays. And that's where it can get a little tricky. And that's where collaboration would be between me and a dentist to figure out, okay, when are you going to take x-rays? When are we going to take x-rays? When are we going to share? And I haven't come across any concerns with that. So it's just having that conversation with the dentist to see, okay, who's going to be doing what, who's going to be profiting from this. But then again, there's the dentist, you can do the teledentistry, asynchronous versus synchronous.
So you have people that you do that with your dentist as well. Got it.
Yeah.
So you take pictures and then send the pictures to the doc and say, hey, tell me what's going on here. Or this is what I think's going on. Can you confirm? And I'll send the patient in.
Yeah, and they can charge out the asynchronous or synchronous kind of dental code. And that's how they can profit as well.
Got it. Okay, that makes so much sense. And then okay, so then from there, like, what would be like a successful month for you from like a number of patients and the revenue side?
Yeah, so at least a minimum of 4 patients. So the logistics of that per day, I'll say that per day. Okay,
I was going to say a month. I was like, dude, that's
no, yeah.
I want to do your job. I'm going to go be a hygienist,
right?
Okay, so and then do you? Okay, so four patients a day is your goal. What's your average? Is that your average, or is that your goal?
That is my average, and that can be taken care of with a family unit. Sometimes it's a family of 4, family of 5, family of 6. So yeah, it's easily taken care of by seeing an entire family at one time.
Got it. Okay. And then, And then, so you're seeing 5 days a week, or do you work on the weekends? Because it's,
As of right now, I'm 4 days a week.
okay,
Yep.
4 days a week. So you're seeing
Yeah.
about
And
16 patients. And then what does that equal from a revenue standpoint, if you're allowed to share that?
That's an interesting question. I haven't broken that down yet.
Okay, cool.
Yeah.
Okay. And then, so man, and then you're also getting the x-rays and all that kind of stuff. So that's really, really cool. So are you like maxed out now? And then you have to open up. Okay. Where would be maxed out for you?
As of right now, so I'd say for instance, like I'm open next week. So I'm still supplementing income by temping, just because I'm not busy enough in my own practice. As word gets out and things like that, again, that goes into marketing and having enough time to market and spread the word out. And then again, it's tackling the fear of dentistry in general is kind of what my challenge has been in getting patients just here. One, the fear of dentistry, and then the fear of something new, right? And this is incredibly new. But once they step in and they hear from somebody else, this is great, they try it, they love it. So it's getting beyond those barriers still. So I'm still supplementing income by temping at offices still. So I'm not quite busy, hence why I still have some offered appointments for next week. So
that's so cool. Well, great job on building this. This is really, really cool. I'm excited to see what happens with this. I think there's obviously tons of opportunity, and the patients need it, right? There's people, it's not like there's not people out there who need it. That's not a question. Everybody understands that. It's like, can you find them, and can you do it in a cost-effective manner to connect with them, give them the treatment that they need, and then connect them with the dentist smoothly, right? Like that's the part that I'm looking at going, okay, that's the tricky part. And it sounds like you're solving that. So that's so exciting. What if someone wants to reach out to you and go, you know what, I want to either one, be in this business, so I want to learn from you and maybe partner with you, or number two, we maybe they want to use you, they're in Colorado or something like that. What's the best way to connect with you?
I would just say my website, www.luxurytoothboothinc.com. And there you can find my email and all that good stuff.
Awesome. Thanks so much for coming on, Sarah.
Thank you.